Nigerian Society of Anaesthetists. My name is Dr. Ifatu Orangusi, and I'm the Secretary of the Education Committee of the NSC. And we would like to welcome everybody to our first session of the 9th webinar series of the NSA. Today being Saturday, 27 January 2024. And at this juncture, I would like to invite the President of the NSA to give us opening remarks, Dr. Olubusola Alabe-Briggs. Ma, you have. Madam President, ma.
Yes, thank you, Dr. Oranusi. Good evening, everyone. I would like to welcome you all to this webinar this evening. This is the first one this year by the Nigerian Society of Anaesthetists as part of our commitment to you in the area of educating members and getting them updated in key issues relating to the practice of anesthesia. I'd like to sincerely thank God for seeing us through the past year, and we're praying for a better and more rewarding 2024. So welcome once again, everyone. And this topic we're hitting the ground running with today is a subject that is all too important, not only for us as medical practitioners, but for every professional, even in the business world, even in the banking world, wherever. We all need to have what we call emotional intelligence. Let me just put it in simple words. Application of wisdom. I think we all have to have some application of wisdom and know how to do things better for better results. So this is all we are going to get to do today. And I tell you, there's no better way to start this year to guide us in all that we're going to do with our patients and with ourselves and with the system. So I wish us all a very good time. And we have invited no other person than one who the cap fits, and we shall cross the T's and dot the I's once he finishes. So once again, thank you, everyone. Welcome, and I hand over back to Dr. Ranusi, who would also be the Ifiatu, who will also be the coordinator for today. Thank you very much, Dr. Ifiatu.
Thank you, Madam President, ma. And once again, I would like to welcome all our participants to today's webinar. Today, we have a very special facilitator today who will be presenting the topic emotional intelligence and good anesthesia practice. He is none other than Dr. Awalu Sani Salihu. He's an associate professor of psychiatry at the Bayero University and Aminu Kano Teaching Hospital. And we are indeed very happy to have him today. Dr. Sali, just a little citation of our today's presenter, Dr. Sali, who hails from Sumaila local government area in Kano State, and he completed his secondary school at the famous Sofa. He then proceeded to Bayero University Medical School, where he obtained his MBBS in 2001, and subsequently joined the residency training program in the Department of Psychiatry at Aminu Kano Teaching Hospital, Kano, in 2006, following which he obtained his fellowship at the Faculty of Psychiatry of the National Postgraduate Medical College of Nigeria. He joined the Bayero University and Aminu Kano Teaching Hospital in 2013 as Lecturer 1 and Consultant Psychiatrist, respectively. He then rose to become an Associate Professor of Psychiatry and Consultant Special Grade 1 in 20. He has additional training. He has a master's in health economics from the Bayero University, Kano, certificate in health economics from the World Bank Institute. He holds a certificate in global mental health from the University of Washington, and also in policy development in health from University of Washington. He has a certificate in digital education from the EPFL in Switzerland. Ladies and gentlemen, I present to you Dr. Awalu Sani Salihu. Prof, you have the floor. Dr. Salisu, you have the floor, sir.
Hello, good evening, everyone. Thank you for the introduction. And I will also start by thanking the Nigerian Society of Anaesthetists for giving me the honor to do this presentation. And I hope that I will make the presentation worth your time. When Professor Datti approached me about the presentation on emotional intelligence to this society, I was really excited because I was so happy.
Hello, Dr. Awalu, can you hear me? I'm sorry, please. It appears we have some communication problem. Oh.
Hello? Hello?
Yes, sir, we can hear you now. You have the floor.
Sorry, I just finished the invitation. Let me try and connect my phone. Since this one is having problem, I can present again. I don't have the PowerPoint on my handset.
I think it's very good that
I will disconnect from this.
the objective of these presentations will include understanding how emotional intelligence impact personal and work life, understand more and be more aware emotional intelligence more effectively to run our practice and lead our teams. I will do the presentation following this synopsis. brief history of emotional intelligence, why emotional intelligence is important for anesthesiologists and other clinicians as well. What is emotional intelligence, and is emotional quotient same as emotional intelligence? I mean intelligence quotients, or was it different, or was it related in some way? And is emotional intelligence learnable? How do we develop emotional intelligence if it's learnable? And how do we identify our emotions? How to measure our emotional quotients and how to learn to handle our emotions and the impact of our emotions on us and other people. So this is the synopsis we follow. Now, by way of brief history of emotional intelligence. The term emotional intelligence was coined by John Mayer and Salovey in 1990. But now the term emotional intelligence is related more to Daniel Goleman. He published a book on emotional intelligence in 1995, and it was an instant hit. The book became very popular, and since then it has undergone many reviews, and Daniel Goleman is a kind of celebrity in terms of uh, presentations across the globe about emotional intelligence, and he has researched this topic and has really enriched it over time. Why emotional intelligence important for anesthesiologists? Research identifies the most effective leaders are ones having a high degree of emotional intelligence. While anesthesiologists are leaders of team, at least, and they also lead health institutions and so on. So it's very important to have it so that you have successful outing as a leader. Now, emotional intelligence is more important for a leader than technical skills and IQ. Given technical skills and IQ get you to become the professional and get you the job, but what make you to retain the job and prosper in the job is emotional intelligence. There are other positive correlates of emotional intelligence in terms of outcome. Leadership success, which I highlighted up, employee morale. If you have high degree of emotional intelligence, the morale of your employee will be higher. Job satisfaction among your employees or your subordinate or your trainees or your students is higher. Job commitments is better among your employees or your subordinate. Teamwork, patient satisfaction is higher. Decreased employee turnover is associated with high degree of emotional intelligence. Less work and family conflicts. Personal life also impacted by emotional intelligence. Patient trust, very important in our day-to-day practice as anesthesiologists. Better doctor-patient relationship and less burnout, which is also all important. They are all found to be better with higher degree of emotional intelligence. Now, when it comes to excellence in the practice of anesthesia, Smith et al. In a publication published in the British Journal of Anaesthesia in 2011, listed some general characteristics of excellence in anesthesia practice. And communication skills and good relationship appears there, and they are strongly part of emotional intelligence as we go along. This will be highlighted in the presentations. Empathy is also important as an important quality of a good anesthesiologist, alongside other things that were listed by Fodoro Decker and colleagues: diligence, accuracy, concentration, responsibility, and others. Empathy is alongside that, and as we go along our presentations as well. empathy is a prominent part of emotional intelligence. By definition, emotional intelligence is defined as the capacity for recognizing our own feelings and those of others, for motivating ourselves, and for managing emotion well in ourselves and in our relationship. Solovia Meyer, who came up with the concept, defined it as the ability to perceive emotions, integrate emotions, to facilitate thoughts, understand emotions, and regulate emotions to promote personal growth. Simply put, if you look at it, what emotional intelligence is about understanding our own emotion, understanding how to manage our own emotion, understanding other people's emotion, and how our own emotion impacts their emotion, and then understanding how to manage our relationship uh, with others. That's what simply emotional intelligence is, all with purpose of promoting growth and a good leadership, a good relationship. And the most important single ingredient in the formula of success is knowing how to get along with people. This is how Theodore Roosevelt put it, and it's really captured how important relationship with others is. It's being successful either in leadership, either in business, either as professional, clinician, someone who deals with patients, like anesthesiologists who deal with patients, and different kind of group of doctors across wherever hospital you're practicing. All manner of clinicians relate with anesthesiologists, and good high degree of emotional intelligence will really contribute in a very good kind of relationship between the anesthesiologist and other team that he works with. There are 4 areas of emotional intelligence, which include self-awareness, which include internal self-awareness and external self-awareness. Internal self-awareness refers to understanding your own emotions. How is it? What are the predominant emotions you have? External self-awareness, understanding your emotions, how it really influences others. And then self-management, emotional regulation. How do you regulate these emotions that you have? And then social awareness, being aware of others, understanding that others have feelings, and knowing that your actions affect other people. You need to know that. And then relationship management involve listening and empathy. Just short while ago, I mentioned empathy and healthy assertiveness, conflict resolution skills, and skillful support and affirmation. These are what constitute relationship management and many other things like that. You look at this quadrant, it's just expressing in an easy way what's really are the focal areas of emotional intelligence. You look at self and awareness, meaning self-awareness, then self-management, others, social awareness, and relationship management, meaning that these are the, others and relationship management is what constitutes the 4 areas of emotional intelligence. Now, your ability to recognize and understand your mood and emotions and their effect on others. This is what self-awareness is. And your ability to recognize how your feelings affect you, and more importantly, how those feelings affect others around you. You have emotions. Those emotions can affect you yourself. And then those emotions can actually affect how you deal with other people. So this is what self-awareness is. And there are certain qualities that make an individual to have better self-awareness. These are commitment. People who have good self-awareness are people who are committed to their goals. They have passion in pursuing the goals, and they are humble and they are teachable. I mean, they can develop themselves. They are ready to develop themselves. Lambo, this self-awareness. Then self-management, your ability to use awareness of your emotions to actively choose what to say or do. Your ability to manage your emotional reaction to situations and people. That's what self-management is. You're aware that if you're having certain emotions, let's say anger, sadness, disappointment, fear, you know, you can now understand this is the emotion you're experiencing. And because of that, what should you say to other people? What should you do so that this will not affect your relationship? And your ability to manage your emotional reactions to situations and people. Yes, this is exactly what I'm talking about. So now, qualities of person with self-management. There are certain qualities that make a person to have good self-management abilities. Patience. One have to be patient. For instance, you are angry. You have to be patient to be able to understand that you are angry and to be able to choose what to say, what to do in that situation. If you're not patient, usually it's just you're angry and you impulsively just do something that is not what you would have done if you take some time to understand what what is your what the emotions what the emotion you are experiencing, um how your or reaction will affect you and other people. Self-control, self-discipline, integrity, and honesty. These are other things that will help one to have good self-management abilities. Social awareness, your ability to understand emotions in other people and what is really going on with them. Perceive what others are thinking and feeling based on their emotions, tone of voice, choice of word, facial expressions, and body language. Yes, it can be difficult for one or almost impossible to know exactly what runs in people's mind. But then our emotions can be expressed in our tone of voice, in our words, and in our facial expressions, and in our body language in general. So your ability to read people by these non-verbal cues and verbal cues will make you to understand how they feel. And in that, uh, you should be able to uh, choose how to interact with these people because of your understanding of the situations they are in. There are qualities also that help one to have good social awareness. Listen. People with good social awareness can listen. Now, we listen to people sometimes, but we just listen because we want to reply them. That is not the kind of listening we're talking about. Talking about our reflective listening where you will attentively listen to a person, sometimes try to actually go over what they said and understand what they mean. That is active listening or reflective listening. And then respect. You also give respect to people, selflessness, and empathy. These are things that help one to have good, excellent social awareness. Empathy is about putting yourself in the person's shoe, try to live his own situations and be able to understand what the person is passing through. Now, assuming you have a patient that you are assessing for instance, in preparation for surgery. In certain situation, the patient wants the surgery so much to be done. In certain situation, the patient is so afraid about the surgery. So you come to assess the person and you try to actually use all the verbal and non-verbal cues that you can get from the person, understand his own situation, that will really help you in trying to come up with a decision about his what will happen to about his surgery. But, based on his condition, it's not possible to actually take him to the theater for the surgery for one reason or the other. Understanding how this message that his surgery will not hold, for instance, is something that requires tact and try to really empathize with the person and try to break the news in a certain way so that the person will understand, and then the level of disappointment he will get will be far less than what it should be if we break this kind of news without tact, without really empathizing with the person. Relationship management or social skills. Relationship management is otherwise known as social skills. People with social skills have mastered the following abilities: communicating effectively, building bonds and relationship, working as teams through collaborations and cooperations. So this is what people with good relationship management do. They have these abilities. Now, for one to develop very good relationship management, kindness, generosity, forgiveness, and developing others. These are the qualities individuals who possess good relationship management have. This brought us to emotional intelligence and intelligence quotients. Are they the same? Emotional quotient and intelligence quotient, are they the same? Now, IQ is what we popularly, most of us, we know first before emotional quotients or emotional intelligence. Now, the measure of intelligence is intelligence quotients. And it's more or less something that we are born with. It's more or less something innate. If somebody is born with learning disabilities, it's difficult for one to just suddenly get a normal IQ and then go back to normal. It doesn't happen. So it's more like what we are born with. Now, EQ, emotional quotient, is the measure of emotional intelligence. So, and EQ is a person's ability to use both his emotional as well as cognitive abilities. And the attributes that are measured in this quotient include but not limited to empathy, intuition, integrity, authenticity, intrapersonal skills, and interpersonal skills. These are the majors that, there are certain questions that one will answer, and there are certain scoring systems that are used, and then so all those put together, they will come up with one's intelligence quotient. There are some tests online that people can use to really get their own measure of emotional intelligence, like their EQ. But some of them you pay some fees to do, and some of them you do free of charge. But then most of them are not really scientifically valid. But some of the paid softwares or tools are really better than others. So we have to look at the source, who developed this software, whether there are people who can really say they have expertise in doing this. And then we can measure our emotional intelligence. And it's very good to have a baseline. And this is what is it. We check these tools, we answer these questions honestly and sincerely, and then we get our scores, and that will constitute the baseline. It's possible that you can actually get certain scores, but it's also understandable that among all the parameters that they're tested, you can score high in certain parameters and you can score low in certain parameters. If you can be able to get all that breakdown, it's very good to understand what part you will pay attention to in terms of improving your emotional intelligence. And that brought us to this. Is emotional intelligence learnable? Yes, it is learnable. Emotional intelligence gets better with age. That is to say that it can improve, and one can actually actively uh, improve his own emotional intelligence. In fact, in some countries, there are people who are coaches in this aspect. They can coach you on how you will develop better emotional intelligence over time. And people really who are very interested and very uh, passionate about excelling in their fields and whatever they are doing, they are really paying attention to this in trying to improve their own emotional intelligence and become successful in what they are doing. So if we want to do that in a very little way, I am not saying by any means that this is enough for one to be able to work and improve his own emotional intelligence, but let us have an idea how it works. And then we can get some online sources, we can get some literature materials to expand on what we learn, what we know about emotional intelligence, so that we can really, if we're interested in improving the degree of our emotional intelligence, we can actually get down to work. Now, how to develop emotional intelligence, if you want to. There's 4 ways one can do. Notice what your emotions are. Learn how to manage them. Understand how your emotional state are impacting others, and learn how to interact well with others. If you look at these 4 things, they are just talking about 4 areas of emotional intelligence. The first one, self-awareness. Second one, self-management. Third one is talking about social awareness. And the last one is talking about relationship management. So these are the 4 aspects we will develop and improve for us to really have a better uh, level of emotional intelligence. Now, noticing your emotion. For you to notice your emotion, one of the questions you need to answer is, how are you feeling? How often are you in a good mood at work? Do you set a positive or negative tone with your team when you start to work, for instance, in a day? You go to your workplace and um, you ask yourself, this morning was my mood, and every other morning, in recent few days or few weeks, what kind of emotion do I come with? Are those emotions positive or negative? And does it really set a positive or negative tone with my team? That really, and our emotion has a serious impact on our relationship with other people. But if we are aware of it and we know what it is, we may be able to somehow self-control ourselves and try to make sure that our negative emotions does not impact on the work we do with our team and in our relationship with our patients, our team, and our co-workers. Um, Moods are very contagious, surprisingly. So you are sad, somehow people around you, you can influence them and make them sad. You're happy, sometimes you influence the people around you, and people will be happy. So you need to understand what mood are you bringing to your organizations, to your team, to your patients, to your co-workers. This is very helpful. And then manage your emotions. Learn how to manage them. If you understand your emotion, how do you manage them? Notice when you are in a negative mood. If you notice you are in a negative mood, for instance, pause before reacting. So Sometimes this pause is what will be a challenge. How do you pause? Some people do that by shifting their emotional states. For instance, you get angry, you take a walk away from people, go around your immediate environment. Is it your house, nearby, neighborhood? Is it at working place? Just outside your office, you can walk around on the street or you can walk around within the facility. And by the time you come back, you will realize that you get a better grip of yourself, and then you can decide what to say and what to do. Or vent to a worker, a friend, a co-worker. Sometimes you discuss with some other people, your co-workers or your friends, you realize what you are angry about is nothing at all compared to other people's experience. Most of the time, when you discuss things with others, they may feel obliged to share their experience in the same aspect of thing you're talking about with you. So you get the experience, you now realize that your own really not an issue at all. So there is no reason for you to even get angry like you did. And then you'll be able to get a grip of yourself and choose what to say and what to do. Some people listen to music. They listen to music, they feel calm down and be able to control and get a grip of themselves. Uh, Others, it's possible that they go and do exercise, physical exercise. Some will really go and play some sports and so on. But whatever it is, choose something that is adaptive. You don't use drugs, for instance. That is maladaptive because you are solving your problems and other problems. So whatever works for you, choose. But what it means is shift your emotional state, be able to decide to get a grip of yourself and be able to choose what to say and what to do. That will really uh, impact your relationship with others. And that's what emotional intelligence is all about. Um, how are you expressing your emotions? How are people reacting to how you express your emotions is important. When you are having a particular emotional states, that's sadness, anger, joy, happiness, you name it. If you express those things, how do people react to those things? Are you able to influence others through your emotions? These are questions you need to answer. People who have able to understand that they can influence other people's emotion, they can use that opportunity to be inspiring leaders, motivating leaders, so that they motivate their staff, they inspire their staff by connecting with them emotionally and appealing to their emotions as well. This is important as well. So this is what will handle the issues of self-awareness of other people's emotions and actually relationship management uh, with other people. Now, before I conclude my presentations, I would say that we were able to discuss the importance of emotions, emotional intelligence, and to clinicians, to anesthesiologists, and what the emotional intelligence is, and the areas of emotional intelligence, whether the emotional intelligence is something we can learn and we can improve. And I think we have answered that. And how do we measure our emotional quotient? And what is the relationship between emotional intelligence and intelligence quotient? And we realize that we have discussed that EQ and IQ work synergistically. It's very good. You have high IQ, then if you have high EQ, that's perfect. But even with moderate IQ, one need uh, a high degree of EQ for one to really succeed. So we have also discussed the kind of steps one will take to improve his emotional quotient and emotional intelligence. To conclude, using some quotation from David Caruso, our emotions need to be as educated as our intellect. It is important to know how we feel, how to respond, and how to let life in so that it can touch you. Emotional intelligence is not the opposite of intelligence. It is not the triumph of heart over head, as some symbolically depict intelligence as a brain and emotional intelligence as heart. It's not so, actually. As we said, they work synergistically, they work together to produce the best result we want. And it is the unique intersections of us, as David Caruso put it. I would have loved to do these presentations live, but for some uh, reasons, I had to record it. But I will try as much as possible with you live, so that I will be able to answer your questions, listen to your comments, and get your contribution regarding this presentation. I hope my presentation addressed some of your uh, expectations, and we hope this can serve as a kind of opener on how important emotional intelligence is to us, and how important is it that we really try to improve what we have. This my reference. I wish you a good evening.
Thank you very much, Professor Salihu, for this wonderful presentation. It was, I believe everybody will agree with me that it was very insightful and educating. And at this point, we would like to invite questions, comments from our participants. You could do well to type your questions in the chat box if you wish. Then if you want to speak to us directly, you can do so by raising your hand, and we will call you up to ask your questions. Thank you. Questions and comments from our participants, please. Okay, I can see our IPP has raised her hand. Professor Wanso, you have the floor, ma. You can ask your question, ma.
Thank you very much, Dr. Ramosy. Thank you, Madam President, and the chairman of the Education Committee, Dr. Detti, and everybody, as all the participants. I will stand on all other established protocol. Thank you, our speaker, for this brilliant presentation. Mine is just a comment to say that this is coming and at a very timely moment. This lecture on emotional intelligence, and I really appreciate the lecture, and the delivery has been very nice and eloquent. Even the voice, the tone the speaker has used has just been very sedate and calm and nice and reassuring. I just want to say that really, in my limited experience, I wish to say that we don't really, generally as medical professionals, as doctors, in particular with anesthetists, but generally, we tend not to really apply enough or adequate emotional intelligence. So I think it would be very nice if this concept can be taught to all of us early in the curriculum, even right from medical school, and even as we young doctors begin to practice and as they grow in the career. Because as from what we have learned this evening and from experience, really emotional intelligence makes a lot of difference to what we do and to our overall outcomes. So I just want to appreciate the speaker and to encourage all of us to imbibe this culture of emotional intelligence as we as we practice our trade, or as we practice our specialty, especially this issue of social connectedness. A lot of times I see that many of us, even I am guilty of it, we tend to be just distant, disconnect from the patient. We just want to come and say, this is your diagnosis, this is this, your surgery is tomorrow, do this, don't eat after 10 p.m. This, goodbye. I hope you have heard me. And that is the end. We sometimes, some of us do not show adequate empathy. And so the patient finds it difficult to, really relate very well with us in the way that is expected. So thank you, Mr. Speaker, and thank you, everybody. And thanks for the opportunity to speak. Thank you. Bye.
Thank you very much, for your comments and insights. On behalf of the president of the NSA, I would like to welcome and appreciate the presence of the faculty chair of the West African College of Faculty of Anaesthesia, West African College of Surgeons, Professor Iniabasi Ilori, who is here with us. We also recognize Professor Fatmonle, who is here also with us. And of course, our NSA Education Committee Chair, Professor Hassan Deti Muhammad, he is here with us too, and Professor Campbell. We'd like to thank you all for being here, and we'll also welcome any comments, any questions, any suggestions you would have for us. You could just raise your hands and we'll invite you to take the floor. Okay, in the absence of all that, I would like to invite the NSA president. I'm sure she has one or two things to say to us. Ma, you have the floor.
Thank you very much, Dr. Ranusi. Thank you very much, Professor Awal, for this beautiful lecture that has been packaged in a very concise manner. And in fact, I so much love the picture that tells us the whole conclusion of the matter. And that is, we need to have a self-awareness, first of all. We need to know who we are. Then we need to manage ourselves better. So that irrespective of who we are, we need to harness the positive side and manage the negative side so that we can be of better impact to others. Then we need to have a social, that is now external, we need to have social awareness. So we deal with ourselves from inside first, and then we need to now deal with others outside. Because of course, a house divided against itself cannot stand. So when we deal with ourselves first and get the best of who we are, then we can manage our external situation. So we need to have a social awareness. And then now begin to adopt how to manage those outside, in our immediate environment and remote environment. So I really want us to talk more, because this subject is very all-encompassing. Like the former president said, now more than ever we need it. It is dawned already on us that this concept of emotional awareness would have solved a lot of problems. I think this was understood very early in other realms, in the banking sector, for example, where, there was revolution, at least for those of us who were banking in the early 70s and, early 80s. We knew how the banking system was. Suddenly, things started changing, and they started having what we call relationship managers, who you go and meet, and they douse every problem you bring before them. So we need to know ourselves, we need to manage ourselves, we need to manage relationships, we need to manage colleagues, we need to manage patients. A doctor who is actually a very good, a very empathic physician, and who knows how to communicate, will have minimal problems with patients, even in the very worst situation. Most of the problems we are having with patients are related to poor communication, and also with our empathy. And again, even managing ourselves, the superior managing the junior, managing his peers. A lot has to be done, a lot has to be improved upon. I'm sorry I have to bring this up, because somehow we all have been victims at one time or the other. When we were learning, in those days in medical school, there was a lot of harshness we encountered. There was a lot of
No, I know that time when you
Hello? Oh, maybe. Okay, Michael, well, time's up. I think you should.
Hello, Dr. Ranusi.
Hello, ma. We can't hear you anymore.
Madam President is off, and some other people are talking on
Yes,
our
I'm trying to. I've stopped the video, and I'm trying to mute the person. Okay. It's muted now.
He said they're hacking. On. Mate, that is bad. Stop trying to mute me.
These are hackers. I'm sorry, this has to happen. It appears we have intruders, and I'm trying to mute.
Not just muting. If you see any stranger person, remove them.
Yeah, take them out. They're hacking them.
Yes, I removed the video, and then they've gone off. They've gone off. I'm sorry about that, please. I don't know if Madam President is still.
There's a hand up. There's a hand up there
with us. Yes. Okay, let me. I can't see the person raising his hand.
There's a hand iPhone. Maybe the person should unmute and speak.
Please, you can unmute and speak, please.
Good evening. Hello.
Good evening, ma. We can hear you. We can hear you, ma.
I think it's a familiar voice, isn't it?
Yes.
Very well, ma.
Yeah. Well, I think this is the first session we are having this year.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
So I wish everybody a very happy, peaceful and prosperous 2024. My contribution to what we've heard in terms of emotional intelligence can be divided up into different aspects. The aspect I want to dwell upon is, as we grow in anesthesia, you develop what we call the sixth sense, which is away from the normal senses, that physiological senses. And this is like an emotional sense in the fact that you call a patient in the morning, and you have a few things that you want to look through in the notes that are supposed to come in that morning. And you got the result, and something in your heart and in your emotion with that surgery, because of certain results, which under certain circumstances, you might let go. And when you get that kind of sense, think twice before you go on. Another example is when you see a patient and the patient is telling you that he has not eaten, and or he hasn't eaten, he's fasted, and you have a feeling that that patient has not fasted. Try and probe a little more. I'll give you an example. When I was practicing, we used to have gynae cases in the afternoon. And I saw this lady and I said, "Have you had anything to eat? Did you eat for?" I said, "Have you eaten? Do you have anything to eat?" Something like that. And then he said to me, "No, I haven't eaten." And then I sort of felt something was not right with this woman, the way he answered me. So I said, "When you came into the hospital, you came very early in the hospital. Did you eat at all? Did you have anything to eat?" He said, "Yes." I said, "But you just told me that you didn't eat." He said, "Yes, I was told not to eat, but they didn't tell me that I shouldn't eat when I get to the hospital." So things like that are certain things that over the years, and with your skill in communication, and you're developing your emotional intelligence, you will be able to sort of feel certain things and say, "No, I'm not going to go on," or "I'm going to get certain things ready because certain things, some events might happen." You have that feeling, and it's with time that you develop that and over practice. But it's important that you don't ignore it and you try to build on it. And I think it comes to you more with practice and experience and interaction with patients. Like Lizzie said, try and go deep as much as possible with patients when you are interviewing them or having talked to them, and then you can get certain things out which can influence your emotional intelligence. Thank you very much.
Thank you very much, Prof. Ma, for these comments. They are well appreciated, Ma. Professor Detti wrote, he said, "As practicing anesthetists, our emotional intelligence is stretched to its breaking limit. For example, when there is a death on the table, we would benefit from a roundtable discussion with panelists from psychiatrists, anesthetists to surgeons, so that we can talk about our experiences." Thank you very much, Professor Detti, for these comments. So, Madam President, I don't know if you would want to finish up before you were cut out, ma'am. Okay, please permit me to invite the NSA PRO for some announcements. Dr. Shelley, you have the floor, please.
Thank you, Dr. Ranusi. Good evening,
Pay your dues.
our trainers, our mentors, and teachers. Happy New Year to you all, dear senior colleagues and colleagues. We want to thank you very much for participating in our webinars. I want to let you know that all these recordings will be made available on our YouTube as soon as possible so that you can enjoy them at your convenience. I also want to employ you all that already we're in 2024 and you know we need the money. And so please, if you have not paid your dues, you are yet to pay your dues, kindly pay your 2024 dues. We also want you to know that the World Congress of Anesthesiologists Conference will be coming up in Singapore from 3rd to 7th March 2024, and the All African Anesthesia Congress will be coming up on the 13th to 19th September 13th to 19th September 2024 at South Africa. And the West Africa Conference will be coming up in March. Thank you.
Thank you very much, Dr. Shelley. At this juncture, we want to thank everybody for participating, and we hope to see you next time at our next webinar. Thank you very much, and God bless.
Before you close up the meeting, may I thank everyone and say that indeed emotional intelligence is all encompassing in everything we do. I was caught out while I was trying to talk about even our commitment to our trainees, you know, even in the area of being empathic, even in the area of being emotionally intelligent about their needs. And I went further to talk about the fact that medical education has, you know, revolutionized beyond what we went through, such that, you know, as trainers, we have the responsibility to ensure that our trainees, you know, are the best in what we call regular formative assessments, so that, you know, by the time they are going for the end point in their exams, which is the summative assessment, they are the best. And this brings in our emotional intelligence in managing them, in probing deep to know their challenges. Of course, trainees also have their responsibilities, you know, to show themselves, you know, in that area. They have their own areas of emotional intelligence, which they have to, you know, apply. So it's virtually in everything we do. A lot of problems will be solved, you know, a lot of crises that some colleagues are going into in the law courts will be averted if they actually imbibed good communication practices and showed empathy. And we know of instances where patients will say, "Oh, we actually know our relation is bad." I mean, a patient's relation will say, "We actually know our patient is bad, but your attitude, your way you approach management encouraged us, and therefore we are pleased." So we don't want to labor this issue for too much, but let's all delve deeper, even after now, you know, to put this more into our practices. And like our mama said, those are some of the areas where, you know, we have the sixth sense. A lot of sixth sense has to be developed in the practice of anesthesia, indeed. I had an experience yesterday where a nurse came and was desperate to get a patient transferred to ICU. And I suspected, I said, why this desperation? And of course, trust what was going on. This patient was actually giving up, you know, and therefore they wanted to dump the ICU, because at times, you know, the patients and the staff in the general ward, they see ICU as a dumping ground to quickly, you know, bring in a dying patient so that they don't have to engage in the last one. So, you know, I just sense that there must be something. And I tell you, by the time I got to the ward, this patient had actually given up. It didn't take up to 10 minutes. So, you know, there are many areas in which we have to display this emotional intelligence. Thank you so much to everyone. I want to, apart from the announcements which have been made, I want to also talk about the next NSA conference. It's taking place by the grace of God in Enugu this year, the coal city, and we have our various guidelines. We're bringing out soon the announcements. So I'm happy Professor Tonia is on board. So we will be getting the announcements soon and the theme so that we can adequately prepare. And we're looking forward to a very fantastic conference. The Singapore, like the PRO said, conference, World Congress is coming up in about a month's time. And some of us are already going to be there with about 7 anesthetists being nominated into committees in the World Federation of Society of Anaesthetists. And that is very impressive. We have members in the Constitution Committee. Major Gubi has been elected into the Constitution Committee. Dr. Sazua has been nominated into the Wellness Committee. And Dr. Adesina into Scientific Committee. And Dr. Obembe herself is also into the the Logistics Committee. So Professor Bolinwaso is also in the Education Committee. Am I correct, Professor Bolinwaso? And Professor Gan in the Obstetrics Committee. Professor Bolinwaso, what's your committee again? I'm sorry. Pain committee. So we have Dr. Adesina in Publicity Committee. So we have a lot of us who have been brought in. It's actually a landmark for us. So we are going to be well represented at the World Congress, and we are hoping that everything goes on smoothly. And finally, the All Africa Anaesthesia Congress is in South Africa this year, and they are already preparing so very well for us. I hope you can all hear me. So on that note, I just want to thank all of you and say that we will continue to do our best to make us work as one and deliver to you as appropriate. So please feel free to call us and talk to us in any area you think is very key for us to focus on. One area I also want to mention to us is the area of clinical practice guidelines. It's high time we develop that, and please, we want to plead with you that when we call upon you to be part of committee for whatever clinical practice guideline, please don't hesitate. You know, it's a sacrifice. So thank you very much to every one of you, and I want to thank Dr. Deity once again for this good work he's doing as the chair of the Education Committee. I want to thank all the members of the Education Committee, and I want to thank our speaker today again. In fact, this lecture is so comprehensive. I mean, it's just a few slides, but there's a lot. It's loaded. So thank you very much, Sir Professor Awal. And on that note, I think I think I'll say good night and thank you for taking out time to be with us. And God bless you all. Have a lovely evening. Good night.
The terrain survey, Madam President.
Okay, terrain study. Yes, please. We want to plead with you. Please actively participate in this. You elected us, and you have expectations from us, and we have done this. We have come this far to roll out a study. Please, if you have not filled the form, fill that study, fill that survey, and also share it amongst members in your locality, in your various hospitals. Thank you. We're expecting a better response from you. Presently, our response is not too good. Thank you, everyone, and good night.